Today let's talk about those pipes and tubes that you see coming off from various parts of our patient body. I call them tubes and pipes. But in this video, I want to break them and categorize them into 4. And I will start with the cannula. Then we'll go to the catheter. Then we'll go to the feeding tubes. Then we'll go to the drains. Cannula, catheter, tubes, drains. Great. What are cannula? Cannula are special needle-like tubes that are inserted into the veins to deliver medication, to deliver fluids, or to deliver special liquid nutrition. If they are put on the surface, which is the commonest, we call them peripheral cannulae. If they are put into the big vessels that go directly into the heart, we call them central venous lines. Then we go to the next, the catheters. Catheters are special tubes, and how I like to differentiate them just vaguely is that cannulae bring in intervention. Catheters take out something from the patient. I will mention 2 types. One is the dialysis catheter, a big special pipe that will be fixed into a big vessel. It will take out the blood. That blood will be connected to the dialysis machine. It will be washed of all the toxins in patients with renal failure, and then it will be brought back through a certain special circuit. That is a dialysis catheter for the patients going through dialysis. Then we have a urinary catheter, which is again a special tube that will be fixed into the bladder to help patients with voiding or output of urine. That will happen in patients who have urine obstruction, they can't urinate by themselves, or patients who are sick and you need to strictly and constantly monitor how much urine they are producing so that you know how much fluid you're giving them and judge how they are recovering from whatever illness they have. Cannula, catheters. One takes in, the other takes out. Then we go to the next, which are the tubes or the feeding tubes. Feeding tubes, as the name suggests, are tubes used to help patients in feeding. Every so often you might find some patient with a tube that is going through the nose into the stomach, and at the other end of that tube, there's a hanging bag of food or porridge or soup, whatever it is. That is called a nasogastric tube. Nose to stomach, nasogastric tube. But they are named differently based on where they are placed. Some tubes are actually placed without going through the nose, especially in patients who have a blockage of the airway or the food pipe, and therefore you can't pass a feeding tube through the nose. So you have to do a small surgical procedure through the abdomen and put that tube directly into the stomach. It is called a gastrostomy tube or feeding gastrostomy tube. Or you place it into the intestines. It can be called feeding jejunostomy tube. So the name is derived from where it has been put. But the function or purpose is to help a patient who cannot feed normally to feed. Either they are too weak to chew, or they have a blockage in the gullet, so they can't feed normally. And then finally, we have the drains. As the name suggests, these are tubes or pipes that collect some substance, some fluid from a certain part outwards. And that is usually from a patient's body outwards. Now, drains are used for several purposes. One of them is as a treatment option. If you have a big collection of some blood clot in the body or some infection with pus somewhere and you don't need to do open surgery, you can actually place a drain there, and that pipe will keep conducting or collecting all that fluid out of the human body until that area collapses and until there's no more of that pus or blood. You can also use a drain to monitor how the patient is recovering. For instance, if the patient has got an injury and there was some bleeding somewhere and you are monitoring how much is coming on the drain and it keeps coming down, it's a treatment or monitoring option. And another, of course, is to check out for any complication. For instance, when we do surgeries and we do joinery of intestines, we might sometimes place some drain next to where we put the joinery of the intestine so that in case there's a break in that joinery, then the contents of the intestines will leak out and we can notice them through the drains. This is not to belabor you with the nitty-gritty and the detail of all the various complexities of the drains, but it's for you to understand that when you see a patient with a special pipe coming off their flank or off their chest or off some area where surgery has been done, it could be subserving all this function, and we use it then to know when do we remove it, is the patient improving, is the patient complicating, etc. We could spread this out, but it would make it complex. If you forget, just remember C for cannula, C for catheter, D for drains, and T for feeding tubes, or F for feeding tubes if you so wish. If you forget everything, remember we use the cannula to bring in fluids or medication or food. We use catheters to take out, most of the time, blood or urine. We use drains to take out infected fluid within the body cavities. And we use feeding tubes to feed through various routes. That, in a nutshell, will explain next time you visit a relative or a friend in hospital and you find all this manner of tubes and pipes going in and out of their body. Thank you for watching. Please leave a comment, subscribe, and follow us.